Anaphylaxis. Anaphylaxis is a severe, potentially life-threatening allergic reaction. It is important to know the signs and symptoms and what to do in an emergency. Common triggers or causes of anaphylaxis. 1. Food. The most common triggers include peanuts, tree nuts, fish, shellfish, milk, eggs, and wheat. Be sure to read labels carefully and inform your server of any food allergies. 2. Medications. Some medications, such as antibiotics, aspirin, and anti-inflammatory drugs, can trigger anaphylaxis. Always inform your doctor of any allergies or adverse reactions you may have had in the past. 3. Insect bites. Stings from bees, wasps, hornets, and fire ants are the most common causes of insect bite-induced anaphylaxis. Avoidance and early treatment are key in preventing a severe reaction. Symptoms and diagnosis. Physical symptoms. Anaphylaxis can cause a variety of symptoms such as hives, swelling, itching, difficulty breathing, nausea, and dizziness. These symptoms may occur within minutes or up to several hours after exposure to a trigger. Diagnosis. Anaphylaxis is diagnosed based on the presence of symptoms and signs of a systemic allergic reaction. Doctors may use blood tests, skin tests, or challenge tests to confirm the allergy. Long-term management. If you are diagnosed with an allergy that may cause anaphylaxis, your doctor may recommend anaphylaxis emergency medications such as epinephrine, antihistamines, or corticosteroids. You may also need to undergo desensitization treatment. Emergency treatment for anaphylaxis. 1. Signs and symptoms. If you or someone you know is experiencing symptoms of anaphylaxis, call an ambulance immediately or call for help. 2. First aid. If you have an auto-injector of epinephrine, use it immediately according to the instructions. Monitor the patient's air breathing and lie the patient flat. 3. Medical assistance. Emergency responders will provide further treatment, such as airway management, intravenous fluids, and medications such as epinephrine. Use epinephrine as soon as possible if needed. Long-term management of anaphylaxis. Prevention. Avoidance is key in managing anaphylaxis. Educate yourself and others about your allergies and the potential triggers. Carry an epinephrine auto-injector at all times. Education. Learn how to recognize and treat an anaphylactic reaction. Take a course on anaphylaxis first aid and educate those around you about the symptoms and how to respond in an emergency. Medication. Doctors may prescribe other medications such as antihistamines or corticosteroids for prevention and long-term management. Risk reduction strategies. Avoiding triggers. Work with your doctor to develop an anaphylaxis action plan, including strategies for avoiding potential triggers. Medical identification. Wear medical identification to alert emergency responders to your allergy. This could include a bracelet or necklace with allergy information engraved on it. Emergency card. Carry an emergency card listing your allergies and emergency contact information. Conclusion. Know your allergies, identify your allergens, and learn to avoid them as much as possible. Be prepared. Carry your epinephrine auto-injector at all times and educate those around you on how to recognize and respond to an anaphylactic reaction. Live your life. Don't let your allergies define you. With proper management, you can live a happy, healthy, and fulfilling life.